talk a little bit about clear braces. Sometimes when patients ask about clear braces, they're really asking about Invisalign, which is a clear plastic type aligner. It's a series of these aligners that actually correct the teeth, that straighten the teeth or close the spaces, whatever we're trying to do. But that's a little bit different from actually clear braces. The actual clear braces are just what it sounds like. They're braces, but they're tooth colored. So it actually kind of blends in a lot more than the metal braces would. The metal braces, of course, just kind of stands out on white teeth. But these clear braces, they really just blend in. But they're actual braces with wires and ties on them. That's a good question. Everyone is not eligible for clear braces, for Invisalign. Everyone's eligible for clear braces, but not Invisalign. There's some bites, or there's some instances where there's a little too much going on for clear aligner to correct the bite and straighten the teeth. The clear aligner may be able to straighten the teeth, but not correct the bite. So in those instances, we actually recommend actual braces, whether it's clear or metal braces for those particular patients. Clear braces do not stain. It's a common myth that, oh, those clear braces stain. Actually, it's the little rubber ties that goes around those brackets. Those are what actually stains. And those are changed every time you come in for an orthodontic visit. So, no, the clear brackets don't stain. The alternative to that also is a self-ligating clear bracket. So now you're not concerned about a tie going on those brackets because they have little latches on them that opens and closes. So now you don't even have to concern about the ties that are staining. That's a good question. It's a question that we get frequently. How much does braces cost? It's almost impossible to give you an exact number, but I can give you a range. Braces are anywhere between, I should say, $5,000 and $10,000, and it definitely has to do with what is going on with your occlusion and what needs to be corrected. The number of appliances that are necessary to correct the bite. So it's hard to give you an exact number, but there's a range, anywhere from $5,000 to $10,000. Your insurance actually does help out with that if you have orthodontic coverage. And in our office, we are happy to help you look through your insurance, figure out whether you do have that orthodontic coverage. And if you do, we are more than happy to file a claim for you to see what the insurance company is actually going to contribute to the total cost of your braces. The occlusion is actually just your bite, how your teeth come together, how your upper and your lower teeth come together. The bite or the occlusion that we're always looking for is a class 1 occlusion, and that's just a dental term that we use. And if you say class 1 to a dentist or an orthodontist, everyone knows what you're talking about. But for the layman, it's a good bite. And that's what we're always trying to correct to, a good class 1 occlusion. Do adults qualify for braces? I would say absolutely yes. If an adult has a concern about their bite, then I would definitely say have it corrected, going through orthodontics. Believe it or not, today our practice is probably 40% adult and 60% kids. So a lot of the adults that weren't able to get their bite or their teeth corrected when they were kids are now going back and having their teeth corrected so they can get the smile that they've been after, most of their lives. I would not say that a lot of times when people have bite-related headaches, it has a lot to do with how the teeth are coming together. And most of the time, if you correct the bite, then all of those problems go away.